Severe pain and joint damage commonly occur due to advanced arthritis, hallux rigidus. Non-surgical treatments fail to relieve symptoms. Correct deformity or joint instability. Eliminate pain and restore stable toe position. Anatomically contoured low-profile plate for optimal MTP joint fit. Multiple screw holes with left/right and dorsiflexion options allow precise alignment and positioning. Variable angle locking technology enables flexible screw placement and improved bone purchase. Provides a strong construct for reliable fusion. Compatible instrumentation and system versatility enhance surgical workflow and adaptability. Position patient supine on radiolucent table. Dislocate and rotate the proximal phalanx through the joint. Insert a 1.6mm K-wire through the center of the metatarsal along the axis. Glide the proximal reamer over the K-wire and ream the metatarsal head. Repeat the process on the proximal phalanx with K-wire and distal reamer. Remove dorsal osteophytes using an oscillating saw if present. Select a suitable plate according to anatomy. Place the selected plate on the joint. Fix plate temporarily using two 2.8mm compression wires with 10mm threads. Use a large compression forceps with speed lock to compress the joint. Check arthrodesis position with weight bearing. Position the straight end of the 2mm variable angle guide on the plate middle hole at the proximal phalanx end. Create a bicortical hole using 2mm drill bit with quick coupling end. Retrieve drill bit. Measure screw length using depth gauge up to 60 mm. Assemble the 2.7mm AV-WISELOCK screw holding sleeve on T15 screwdriver shaft with 1.2 Nm torque limiting attachment to handle for torque limiting attachment. Hold measured length 2.7mm AV-WISELOCK self-tapping screw with AV-WISELOCK assembly. Insert screw into pre-drilled hole. Retrieve AV-WISELOCK screwdriver assembly. Place 2mm self-centering double drill guide on compression hole. Create a hole using a 2mm drill bit. Measure screw length using depth gauge. Assemble 2.7mm cortical screw holding sleeve with T8 star head screwdriver. Attach the measured length 2.7mm cortical screw to the cortical screwdriver assembly. Insert cortical screw into oblong pre-drilled hole. Tighten screw for final compression. Retrieve screwdriver assembly. Place the cone end of the 2mm variable angle guide on the metatarsal hole of the plate. Create a unicortical hole at desired angle using 2mm drill bit. Retrieve drill bit. Measure screw length using depth gauge. Attach the measured length 2.7mm AV-WISELOCK screw to the AV-WISELOCK screwdriver assembly. Insert AV-WISELOCK screw into hole. Retrieve AV-WISELOCK screwdriver assembly. Repeat the screw insertion process in the remaining holes at desired angles. Keep holes near sesamoid bone unicortical. Place 2/1.1 mm double drill guide for Herbert screw at proximal plantar side. Insert a 1 mm K-wire from proximal to distal and plantar to dorsal direction. Confirm placement under fluoroscopy. Retrieve the double drill guide and place the 2 mm end of the double drill guide over the K-wire. Drill 2 mm cannulated drill bit with quick coupling end over K-wire. Retrieve drill bit and double drill guide. Measure screw length using depth gauge for Herbert screw over K-wire. Retrieve depth gauge. Load the 3 mm Herbert screw onto the holding sleeve for 3 mm Herbert screw by rotating the sleeve clockwise. Attach holding sleeve handle for Herbert screw to holding sleeve. Insert the Herbert screw assembly into the bone over the K-wire in clockwise motion. Stop when the holding sleeve touches bone. Retrieve the holding sleeve handle and insert the T8 cannulated screwdriver shaft for Herbert screw with handle with quick coupling for Herbert screw into the holding sleeve. Rotate screwdriver assembly clockwise while holding sleeve. Herbert screw unscrews from holding sleeve and deploys into bone. Retrieve the screwdriver assembly, holding sleeve, and K-wire after fixation. Metatarsophalangeal fusion using Oxion's MTP fusion M plate and Herbert screw completed. Immobilization with splint or boot to protect the fusion site. Restricted weight bearing as advised by the surgeon. Regular wound care and follow-up for healing assessment.